Hello everyone, and thank you for watching our demonstration video on the all-new Therapy Reports Pro. My name is Adam, and I am tasked with taking you through today's demonstration. I'm actually going to start our demonstration of Therapy Reports Pro in the Lytec Practice Management System today. Here you will see I have the Lytec schedule brought up, and I have several patients scheduled for today. Steve Lytec is currently set as being seen in the status column, and the other three, Jonathan Connor, Zippy Gonzalez, and John Smith, are all set to pending. I want to demonstrate that the status for Steve Lytec that is set to being seen can actually be read directly from the Therapy Reports Pro program. So I'm going to minimize Lytec and bring up Therapy Reports Pro. Therapy Reports Pro has a list of today's appointments in it. It doesn't have a full-fledged appointment scheduler because it is not designed to replace your existing appointment scheduler, but is certainly designed to augment it. I can use the button up at the top that says Today's Appointments to bring out today's list of appointments, or I can use the slider button on the left-hand side. This allows me to bring out and hide the appointment list. Notice that I have the same 4 appointments in this particular screen as I did in the Lytec screen, and notice that Steve Lytec is currently set to being seen. If I were to go back to Lytec and change his status to something like waiting, or if I were to add a patient, then that update would happen automatically within the Therapy Reports Pro program. For example, if I bring this back up, now you see that his status is waiting. This is because you have a live connection between Therapy Reports Pro and Lytec. This is very different than most other solutions out there on the market today. This is a live link to the Lytec data. There is no HL7 messaging, there is no bridge, and there's no service applications that need to be running in the background in order for me to get these constant updates. In this particular case, I want to go ahead and create a new visit note for Steve Lytec. Now, there are several different ways I can go about doing that. I can click the Visit Notes button up at the top of the screen. I can go to the patient's chart and initiate it from there. Or I can double-click on his name in the appointment grid. What that does is that brings up the Visit Notes screen and automatically populates it with the patient's chart, the patient's name, their case, and their chief complaint. If I wanted to change the patient for this particular visit, I can use the standard lookup button to bring up any other patient in the list, or I can even start typing in the patient's name, last name first. That automatically fills in the rest of the boxes for me and brings up the closest match as I type. In this case, it is Steve Lytec that I actually want to create a visit for, so I'll go ahead and type in Lytec. And you'll notice that my cursor goes to the Visit ID field. If he had any existing visits, I could look up those visits and bring up those visit notes. But because he doesn't, it's completely empty. And you'll also notice that over on the right-hand side in the New Visit button screen here, we have 4 different visit types. A new initial exam will start a new initial exam for Steve Lytec. There's also daily notes, progress reports, and discharge reports available, but those are grayed out to me. And the reason that they're grayed out is because he hasn't had an initial exam yet. Once Steve has an initial exam, that button will become grayed out, and the other 3 buttons will become enabled. I'm going to go ahead and click the New Initial Exam button. What that's going to do is that's going to bring up a Confirm Treatment Authorization screen for me. If I had any prior authorization numbers attached to this patient's chart, it would make sure that I selected the correct prior authorization number so that we could count down the visits. It also shows me when their next visit for their referring provider or primary care provider is going to be. In this case, it's going to be in 13 days. If during my conversation with today's patient I discover that it's actually going to be sooner than that, I can actually change that date right here and it'll automatically update it in the chart. For right now, I'm going to continue to the initial exam. When I click the New Initial Exam button, the Visit Notes screen will fill with the tabs I need for this kind of visit. Supporting documents, functional activity, objective assessment, goals, plan, narrative, and today's treatment, which contains not just our treatment items, but our gym, home, and therapeutic exercise logs. The first tab is our Supporting Documents tab. This tab allows you to add any Word documents, images, or portable document files to the patient's chart. I can choose to add a specific scanned or created document, or image using the green Add button in the upper left-hand corner. I can also use the Favorites button to bring up any documents that I use on a regular basis. For example, I have a body chart here that I can add to the patient's chart immediately. When I click on the body chart, I can double-click on that item and edit it right here on the screen. For example, I can draw, annotate a certain area that might hurt. I can draw arrows, and I can even include text. Hurts here. When I click Done, that becomes immediately part of the patient's chart. The Functional Activity tab is the next tab. Now, the Functional Activity tab utilizes these grids that are used throughout the program, and there's something unique about these grids. We can literally type in any value you want in these particular grid fields. If I wanted to say jumping activities was something that we wanted to do under Functional Activity, I could easily type it in. If for some reason we want the functional activity to be able to run a marathon in 21 days, we could certainly type that in. The other thing that we can do is we can utilize these lookup buttons to access our pick lists. In this particular example, I could say jumping activities. Now, the checkboxes to the right of the activity include recheck and goal. Recheck, if I were to check that button, would indicate that this is a kind of activity that when we come back for a daily note, we want to recheck that every time. Goal, if I check that box, will automatically copy the jumping activities to the Goals tab. Impairment offers a pick list, but also I could type in anything I want. In this particular case, I could say that the impairment is pain. And then status offers what's called a number pick list. So we could say that they are currently a 1 out of 5. Now, I could continue adding additional functional activity items, but the chances are good that this is not the first knee exam that I've done. So one of the techniques I'm going to employ to try to make my life easier and make this exam go as quickly as possible is I'm going to use the Add Template button. When I add a template to the program, it's automatically going to fill in these functional activity, objective assessment, goals, plan, even the narrative in today's treatment tabs for me, based on the kind of visit that I'm doing. In this particular case, I'm going to do a knee exam because he is complaining of a knee injury, and I'm going to say OK to that. It's going to ask me if I'm sure. Sure, why not? And what's going to happen is it's going to automatically bring in a bunch of functional activities that I can assess. This is based on this particular template. Now, if for some reason I don't want to assess stair climbing, I can easily remove that. Squatting activities, I can remove that as well. If you leave one of the impairment columns blank, there is a setting in Therapy Reports Pro which says we can remove those automatically. So if you don't want to go through and actually hit the remove button, you don't have to. In this particular case, we have walking and running hills. We're going to say that that's definitely painful. Kneeling activities is stiffness. And running or jogging is fatigue. Who doesn't get fatigued while running or jogging? And again, we're going to fill out these statuses, 1 on a scale of 5, 1 on a scale of 5. I like a scale of 5. It's nice and convenient. Obviously, you can use any scale or any system you want to fill in these particular values. The program is extremely flexible in that way. Now, down at the bottom of the Functional Activity tab, we have our pain scale. I can indicate that he has a pain level of 7. And we have a Functional Indices section. In this particular case, I'm going to say we're going to do a photo, and we're going to give him a score of 85. Notice that the functional index is when I add a functional index, it automatically gives me the option of adding additional functional indices. There are no limits to how many functional indices you can add to a visit note. Also notice at the bottom of this section, there's a functional limitation reporting section. This is because this guy's a Medicare patient. If he wasn't, this whole section would not bother to show up. This is a requirement by Medicare. It allows us to specify his disability type, what our current status evaluation is, and what we hope to get him to as a result of therapy. In this particular case, it's definitely a walking and moving problem, and his initial status, we're going to say he's 60 to 79% impaired. And the reason we think that is based on the validated functional measure tool. We'll use that as our justification for that. And then we're hoping to get him to, we're not going to say 0%, we're going to say 1 to 19% impaired. That's our goal on that. Now, notice I said goal. The reason I said that is because when you go to the Goals tab, it automatically brings in the walking and moving goal as a long-term goal for therapy. So it's constantly on your mind that you did say you wanted to get him between 1 and 19% impaired. Once you've done the functional activity, you can move on to the Objective Assessment tab. This tab, again, has also been filled in automatically based on my template. Anything I want to move around or change, I can do that because we're not locked in to using the template exactly as it is. Notice that I do have a scale value of 0 to 5. I'm going to go ahead and utilize that to fill this thing in. And we're going to say 2, 2, 3. There's also a column for comments. We can put any comments we darn well feel like it. It's our system. It's very flexible. Some people have asked me in the past if it's possible to have the current value set to left and right. These columns are all completely customizable, so the answer to that question is yes. Yes, you can. You can have a current value left and a current value right, and even compare those values in future reports. Once I've filled that information in, I'm going to go to the Goals tab. His objective for jumping activities is he'd like to get there. He'd like to be a 5 out of 5 because he's currently a 1 out of 5. And then the time frame of, we're going to go to weeks and say 2 weeks because it's a short-term goal. Because it's a short-term goal, I don't also need it under long-term, so I'm going to go ahead and remove that. And we're going to say the long-term 1 to 19% impaired time frame is going to be 6 weeks. Once we're done with the Goals tab, we can move right on to the Plan tab. And utilizing the pick list, I can pick some plans for what we're going to do for this guy today. Let's do electric stimulation. Let's do, I don't know, joint protection techniques, and we're going to give him a gym exercise program today. Why not? Moving on to the Narrative tab, you'll see that a bunch of text has been brought in based on the template that I've selected. Some of this text is very special. The colored text can be interacted with. For example, Steve is a 71-year-old, and I can click on patient activity level and say that he's actually moderately active for a 71-year-old male. This injury occurred as a result of, in this particular case, I'm going to say multi-select. He was playing tennis, but he also had a general lack of coordination. So, tennis and a lack of general coordination. Complications to achieving our therapy goals include, well, his pain, the compliance level, and transportation to and from therapy since he is 71 years old. Now, this is just one of the ways in which we can help make your data entry into the Narrative tab as quick and easy as possible. I happen to have a copy of Dragon Naturally Speaking loaded on this machine, and I'm going to attempt to dictate into the system for you. Upon evaluation today, Steve is ambulating with dual axillary crutches and very little weight bearing on the right meniscus, period. He presents with a major contracture of negative 40 degrees of extension, and 62 degrees of flexion, period. His joint is very painful and stiff passively, period. We discussed the therapy plan and the need to be aggressive with his degree of motion loss, period. He responded well to treatment today and is very motivated, period. Microphone off. This is a copy of Dragon that I loaded less than a week ago, and it is extremely accurate. This is Dragon version 12. I didn't pay extra for the medical version, so it really does work quite well and can help make these narratives go very quickly. The final tab is the Today's Treatment tab. Based on the template that I selected, there are several treatment items already in here. We're doing a physical therapy evaluation, therapeutic exercises, home exercises, and joint mobilization. I'm going to go ahead and go to the home exercise log, and from that home exercise log, I'm going to assign a few exercises. I can do that by clicking on the lookup button in the grid, and in this particular case, we said he has a knee something or other, so let's find something with knee in it. We'll say knee passive extension using roll. The other thing that we can do, though, is we can add a protocol or a list of exercises by hitting the Add Protocol button. So closed chain kinetic knee exercises. Sure, why not? And automatically that assigns him many exercises to do in the gym. Note that the exercises automatically come in with the reps, sets, duration, frequency, and instructions that those pick list items were created with, but you can actually edit those on the fly here before assigning them to the patient. The other nice thing that you can do is you can actually print a handout for the patient to take home, which will explain how to do all of those exercises that you've just assigned. So what I'm going to do is I'm going to go ahead and sign the note. And I can even print out a copy of this note for the patient's chart. In this particular case, I actually have a fax cover page on there. We're going to send this to our referring provider, Dr. Indiana Jones. And that actually allows us to print and display each of the items that we assessed today, including all of our functional activities, objective data measurements, goals, short-term and long-term, our plan for care, etc., treatment administered, etc., etc. Now, I started off this demonstration by showing you the link between Lytec and therapy reports, and so it is only fitting that I end it the same way. If I click on Billing, Create Pending Transactions, this screen will automatically load with all of the items from today's visit. Notice that the functional limitation reporting CPT codes are also there. This is really important if you want to get paid by Medicare. Now, normally this would load with more than one patient if I've seen more than one patient for today, but because Steve's the only guy I've seen for this particular demonstration, his CPT codes are loaded above. All I have to do to send these as a pending transaction to Lytec is hit the Send Charges button. I get the charges have been sent, and now there's no more charges that need to be sent, and we're done. So much easier than any of the other solutions out there. If I come into Lytec, close the schedule, and go to Pending Transactions, and there's a couple of hold codes, you'll see that everything that I just sent over is right here at my very fingertips. All I have to do is hit the Save button, and this becomes a bill. I really appreciate your taking the time to go over this wonderful new program with us. If you have any questions at all, feel free to reach out to us at 877-527-2407 or at info@emailpss.com.